Alrighty, so hello everyone. My name is Shelby Ankerfelt. I am a T4 ACM student at Northwestern, and I also recently added on the functional nutrition master's degree. So I'm going to be going through an environmental scan and communication plan for the Willow Tree Clinic. We are based in St. Cloud, Minnesota, and here we go. So any internal and external stakeholders of the clinic. So internal stakeholders include Jessica Sunsdal, who is the owner and operator. She founded Willow Tree Clinic almost 15 years ago. She is a licensed acupuncturist and has added on several different modalities like craniosacral. She also can teach Kundalini yoga. So several things that Jessica's been doing. Another internal stakeholder is myself, Shelby Ankerfelt. I'm a current student, like I said. I plan to go up to St. Cloud and join Jessica at the Willow Tree Clinic as soon as I graduate. So any and all future and current employees are also internal stakeholders of the clinic. They get their income from working there, and we know that that can be difficult, but the wellness of the clinic really reflects on their income as a whole as well. External stakeholders include clients of the clinic, providers of Western medicine who send their patients to us. We have quite a few people from the Orthopedic Surgical Center up in St. Cloud that send their patients to us during their rehabilitation. Any current and past family members of clients who benefit from our work. So we are an acupuncture clinic who also has massage as well, but we work with a lot of people. We work with a lot of mental health disorders, addiction, fertility. These are really some life-changing things. So we truly think that the family members of our clients can also benefit from our work as well. Our scope of practice and roles and the resulting outcomes. So our scope of practice is mainly traditional Chinese medicine and acupuncture. It is also the care regarding the functional nutrition that I am now learning as time goes on. And we also have different modalities related to our secondary cares, such as massage, spiritual therapy, and more. We do have some practitioners that will rent out a room at the clinic so that they have a space to practice their modality. And it's that scope of practice really is based on your own degree and certifications in whatever field of medicine that you've chosen. So our rules of practice are specific like to the modality and licensure. Like I just said, we only take acupuncturists that are licensed through NCC AOM, and also through the Minnesota state. So they have to pass the boards before ever joining us. Resulting outcomes of our clinic, we hope that everybody is safe, secure, and supported in our roles in our time at sorry about that, in our time at the clinic. We want to maintain the safe, secure, and supportive place as long as we are in practice. So some overall clinic viewpoints. The daily schedule will involve a mixture of Jessica Sunsdal. She is going to be stepping back from her current full-time position there to around 35% of the time. She'll be a practitioner in the clinic. And myself, I'll be about 65% of the time. We are going to be opening up to weekends open as well, which we have never had since Jessica started the clinic. So that'll be an exciting thing. So we will revolve between 4 clinic rooms to care for our clients. On the days that I'm the only acupuncturist, other practitioners and modalities can come and use the open rooms, like massage and the spiritual therapy, like I said. So the day-to-day aspects also include a lot of office work, coordinating with insurance companies, submitting insurance claims, reaching out to local VA and surgical units when clients are referred to us. There's also accounting that needs to be done to run the business. And we will ensure that all financial transactions are recorded and the clinic's inventory will be maintained with a FIFO policy, first in, first out policy. With the TCM, herbal formulas, and functional nutrition supplements, we will need to ensure that all of our prescriptions and supply are maintained and secured. We don't want anybody to not be taking any herbs that they don't need to. So our big picture, we hope that in 7 to 10 years, we will have the finances to move locations to a larger clinic base. We see this clinic moving into a larger location so that we can then make the Willow Tree Wellness Center, which will have several more treatment rooms and the availability of a spacious environment for more community care type of work. This new location mentioned in the big picture will allow for more practitioners to join our wellness center, which we will assume will be a great change for our patients. The current clinic does not have enough room to add the amount of practitioners in different modalities that we hope to add. So with this change, we are looking for more practitioners and more space for healing. The best outcomes related to the clinic, we hope for an increase in net income, an increase in overall patient numbers and patient return. We want to contract more practitioners instead of just having them rent our rooms. We will be looking to change our location, and we still want to maintain our high level of care and clinic equipment functionality. So, like I said, the best incomes are overall dependent on the success of the clinic over the next 10 years. We are hoping for an increase in a lot of things. With the addition of a second practitioner in late 2025, we're hoping that the amount of patients will push the clinic to capacity, which will allow for the excess income to put toward a fund for a new and larger location, as well as to buy newer and updated equipment, such as an electronic Moxa machine. The change in location will allow us to increase the amount of practitioners we can have on contract, which we anticipate the patients will enjoy. During this time, we are adamant on maintaining the same high level of care and support for our clients. So a timeline. I will be graduating from Northwestern Health Sciences University in 2025 and will be joining Jessica Sunsdal up in St. Cloud, where she will be reducing her hours to about 25 hours a week, and I will be upping my hours. So in 2030, I will have finished with my 5-year contract with Jessica in the Willow Tree Clinic and will be taking over as the owner of the Willow Tree Clinic LLC. In 2035, Jessica will be stepping back from the clinic and Shelby will be taking over completely. And any changes will be addressed at this time. We're talking like the larger changes, like a change of location, additional practitioners, and change in policies regarding the expansion of the clinic. We will be using this time to ask our clients in the community if there are any changes that they wish to see in this new location and any new modalities and or things they wish to see from the original clinic transfer over to the newer clinic. So messaging for new and different audiences. We will be doing some community speaking events with different groups. I will be going to the St. Cloud State University and St. Cloud Tech University or St. Cloud Technical College and speaking to their students and their different clubs about student discounts with us, athlete discounts. We've been talking about setting up these times around the 2025 area. We would like to maintain our support for the LGBTQ plus and diversity clubs on these campuses as well. So along with going out and speaking to these groups of people, we will be sending out memos with the VA to ensure that office attendants tell the patients that they can receive free care with our clinic. And we hope to have a grant-funded community care programs in which we would communicate through outreach with social workers and employees. So barriers and opportunities. Of course, we cannot expect everything to be planned out perfect. So barriers do include some unexpected situations like weather damages, a global pandemic, for example. So those just kind of happen in life. So we're planning for those as well. Another barrier is patient numbers not increasing and patients not wanting to book with the new practitioner, me. And any insurance coverage changes over time. We cannot plan for the insurance companies to continue to pay. So we will have to be very careful with that. Some opportunities, like I mentioned, a grant-funded community acupuncture program and the programs related to college groups and teams. Medicare is now taking acupuncturists. So we will have an increase in the 65 and up population as well. So with SOAR analysis, some of our strengths that we can work on is patient return, insurance-based availability. Maybe we can increase some insurance companies that we take. So we have more people with differing insurance. We want to make sure all of our clients are satisfied and furthering the amount of our care our patients can receive with us with new practitioners. Some opportunities, many of these have been listed, but we will also be polling our patients to see what they would like to see in our clinic so that our stakeholders are receiving what they've asked for. Some aspirations of our clinic. We wish that this clinic is the healing place for our patients. We want our healing journey for our patients to be the most comfortable as possible, and we hope that we can continue to give availability of our resource for everyone. We hope to have results that are satisfied patients in the continuation of our journey in building the Willow Tree Wellness Center. Thank you.